This segment is sponsored by GBMC Healthcare.
A recent CDC report showed that hospital emergency rooms are seeing a larger portion of children with mental health problems during the pandemic. So joining us to talk about this issue is Dr. Anthony Chico, Medical Director of Emergency Psychiatry at GBMC. All right, Dr. Chico, so which age group do you think you've seen visit the ER for mental health reasons during the pandemic, and why?
Well, thanks for having me. We've seen an increase in both children and adolescents. The CDC study looked at the percentage of children coming to the ER in 2020, right when the pandemic started, up until about October. And looking at that time frame compared to 2019, we saw a 25% increase in children coming to the ER for behavioral health concerns and over a 30% increase in teenagers. And what the CDC found was really similar to what I've seen and my colleagues have seen at GBMC.
And so what is the take-home message from that CDC report?
What the authors were emphasizing in this study is that despite early on, if we think back to March, April, that was a time in our country where we're really locked down. And we did see an overall reduction in numbers of patients coming to the ER. But despite that, parents were so concerned about their child's mental health that they were coming in at a larger percentage. So it really speaks to the strain on the mental health stressors that children were going through at that time.
And so what else besides isolation and loneliness is really driving a lot of distress for the kids?
In addition to that lack of socialization, what I've seen and heard from many patients is that just the stress of school. I'm seeing a lot of children who in 2019 were honor students, were doing really well in school, and really for the first time in their life, they're finding themselves struggling academically. And that's, you can imagine, brought a lot of distress for the child.
For sure. Now, I know that parents have to be lost, right? If a parent suspects that their child is having a mental health crisis, what should they do?
Well, you know, I say to every parent, first, just talk to your child. Don't assume what you're seeing and hearing. You know, just check in with them to see what you're seeing compares to what they're feeling and experiencing. Certainly, if they're struggling with their day-to-day activities, I think it certainly warrants a conversation with their primary care physician. Unfortunately, I'm also seeing a lot of children who at times will take out their frustrations on themselves. They're acting more aggressively, more impulsively. And in those circumstances, an emergency department visit is certainly warranted.
Okay, we have all the information there available on our screen. We know where to find you. Thank you so much, Dr. Chico.
Thank you. Appreciate it.